Good morning, everyone, and welcome to today's webinar, Exploring Social Environments for Health. This webinar is the first webinar in a three-part series on social environments for health. My name is Monica Nunez, and I'm a Knowledge Exchange Specialist at Public Health Ontario, and I have the pleasure of moderating today's session. I'm now very happy to introduce our speaker for today's presentation, Andrea Bodkin. Andrea has worked in health promotion and public health since 2003. As a senior program specialist in health promotion here at PHO, Andrea brings enthusiasm and much expertise for planning in all forms: evaluation, community engagement, partnership development, and facilitation to public health units across Ontario. Andrea holds a master's degree in public health with a specialty in health promotion from Deakin University in Melbourne, Australia. Many of you may know also that Andrea hosted 3 seasons of the podcast Tenfold, and recently led the development of an online introductory course called Health Promotion Essentials, which you can find on the PHO website. So thank you, Andrea. And with that, I'll pass it over to you.
Thank you. Thank you so much, Monica, for that introduction, and welcome everyone. It's exciting to see so many people on a Monday morning so early in the new year. So I identify as a white cisgendered woman of settler heritage, and I'm aware that many of the privileges that I hold today are a direct result of the decisions and the actions of my ancestors who settled in southwestern Ontario throughout the 1800s and 1900s. And that's why it's important for me to learn more about the land that I'm currently sitting on. And today I'm coming to you from my home, which is beside the Wiskotenach River, which you can see here in the background. And it's now known as the Don River in Toronto on Treaty 13. And these lands have been home to First Nations people for between 7,000 and 10,000 years, depending on what source you read, beginning with small groups of nomadic hunters, followed by Wendat longhouse villages in the 1300s. In the 1700s, the Mississaugas moved into the region as the Haudenosaunee withdrew south of Lake Ontario. And in 1807, believing that they were renting out lands to the British, the Mississaugas signed the Toronto Purchase and surrendered their lands, which later became York and now what we know as Toronto. The nation was resettled in current-day Mississauga, and 40 years after that were once again resettled in Haldimand County. In 2010, the Mississaugas settled a land claim with the Canadian government for $145 million. And today, the Mississaugas of the Credit are a vibrant nation of about 2,500 members, both on reserve in Haldimand County and off reserve. So today's webinar, as Monica mentioned, is the first of a 3-part series on social environments for health. Next week, we are going to be hearing from Alyssa Bedard from Planet Youth Nipissing, Inga Rosendahl from Ottawa Public Health, and Ben Gallagher from the City of Mississauga. And they are going to talk about how they are working at the local level to build healthy social environments. And our third webinar, which will be on February 5th, will have Natasha Baudouin and colleagues from the Alliance for Healthier Communities talking about social prescribing for health equity. And the research for today's webinar and the handout for today's webinar is this focus on social environments for health, which was published in September. So today what we're going to be focusing on is the basics of social environments, what they are, how they can be measured, the key models and frameworks that can guide our work. And the focus on that I mentioned earlier is the handout for today's webinar. We'll post that in the chat for you. And we will also be sharing slides, which will be posted in about 2 weeks when the recording is posted. So there has been decades of research into what influences health, access to healthcare, access to resources, the social, economic, and structural determinants of health behaviors. We know so many different things go into making someone healthy or not healthy. The model that is particularly relevant when we're talking about social environments is called the socio-environmental model. And this model focuses attention on both the individual and beyond the environmental factors as a foci for health promotion action. It addresses the importance of initiatives directed at changing interpersonal, organizational, community, and public policy, which are factors that support and maintain health behaviors and health. So the underlying assumption of this model is that changes in the social environment are going to produce changes in individuals, and that the support of individuals in the population is essential for implementing environmental changes. And this model was published in 1988, which is just 2 years after the Ottawa Charter for Health Promotion. And where the social environments fit into this is at the interpersonal level. So we're talking about formal and informal social networks and social support systems that are important sources of influence in health-related behaviors. And they influence those behaviors by shaping norms, by providing or not providing environmental opportunities that support health-promoting behaviors, support well-being, and produce or reduce stress. And the social environment can be constructed of so many different people in our sphere: family members, friends, peers, acquaintances, the people that we work with or go to school with. All of these people can act as role models, as social influencers, and exert peer pressure. So the social environment, not at all new to health promotion. As I mentioned, the first conversations about this model was published in 1988. But it seems like there's been more and more and more discussion about how we can build environments that promote social health as well as physical health. And while public health is only one of the actors in this arena, I started to get really curious about what social environments even mean and what they are and how we can measure them and how we can build them and all of those kinds of things. I conducted a literature review, and we're very fortunate at Public Health Ontario to have a whole team of librarians to help us out with our searches. So in consultation with them, we developed the research question: what does the concept of healthy social environments include, and what are the applications for local public health and other partners? So, and our search strategy was done in 2 databases, as well as using customized Google search strings. We ended up with just over 1,100 results, which we then screened to identify papers that specifically examine the social environment, that are related to public health or relevant for public health in relation to a health behavior or a health outcome. So for example, physical activity or cardiovascular disease in OECD countries from 2004 forward. And for those of you who get very excited about methods, if you want to know more about our search strategy and screening process, please feel free to contact me, and I'd be happy to share that with you. So we ended up with 16 studies. We had some data analyses, literature reviews, primary studies, 1 website, 1 report chapter, 1 model, and 1 framework, about half and half published in gray literature. We had 2 articles that looked at social environments as a standalone concept. 7 were looking at physical activity, so a lot of research in that space. And then 1 each in the rest of the categories, like how does the social environment contribute to healthy neighborhoods, healthy communities? How does the social environment impact health disadvantage? That's the term used by the paper's authors. How does it promote older adult mobility, contribute to health differences between urban and rural settings? So we extracted data from the included articles, analyzed the data specifically around how social environments are defined, what characterizes social environments, so what does it actually break down into, how those social environments contribute to health, and of course, the tools and the frameworks. So let's take a look at the results. So the first thing that I noticed when I started looking at the search results of over 1,100 articles is that a lot of articles use the term social environment, sometimes even in the title or the abstract, but when it came to the actual paper itself, social environments weren't really discussed explicitly or defined even. So there was a lack of consistency when social environments were defined at all, and less than half of the included articles defined what it means. So In the definitions that I extracted, there were some commonalities between them. So, for example, all of the definitions talked about personal relationships, social processes within neighborhoods and communities. Some definitions included the importance of culture, which is particularly important with Indigenous peoples and also with folks who are newcomers to their country or second or third generation. Some articles or papers talked about sense of belonging and perceived stress, but probably the most comprehensive definition came from the British Columbia Centers for Disease Control in their social environments framework. And their definition of social environments are all of the context that we live, work, and play in. And it includes interpersonal elements of environments, the structures and the processes that we create, the relationships that we have, the actions that we take, and the social environment influences and is influenced by individuals' relationships, interactions with other people, with their communities, with their physical environment, with public and private organized systems. And it's also present at multiple levels. It's people and relationship centered, it's interconnected, and it's influenced by power. So the other thing that I looked at was trying to really break down what social environment means because, okay, it's about personal relationships. It's about the connections that we have with communities. But if we're going to be developing initiatives that build healthy social environments, or if we want to incorporate building social environments into our current initiatives, what could that actually break down and look like? And there are six factors or components, I'm calling them domains for simplicity, that I found in the included papers. And the ones here listed, the six listed here on the slide that I'll go into in a moment, were included in 4 or more of those included papers. Now, just a note here. Many of the papers used these terms or similar terms, but did not actually define them. So I did have to make some assumptions about which domain things should be slotted into. And of course, there's always a little bit of personal interpretation there. I will try my best to make the definitions as distinct as possible. And also note that some of the domains are very similar and they're very connected or connected to other components. So I'll try to differentiate as best as I can. So I'm going to start off by talking about social cohesion. And the simplest way to think about social cohesion is feeling a sense of belonging in the community, the extent to which the neighborhood is socially connected and shares social norms and beliefs. And there were 3 papers that cited the collective efficacy scale, which was developed in 1997 by Sampson et al. And this particular scale, and in fact, almost all of the measurements that I'm going to talk about for each of the 6 domains are perceived. And so a series of questions are asked and a Likert scale answer key is given. So participants responded to a certain number of statements using that Likert scale. And there were 2 studies, the HAL study, which I'll talk about in a few minutes, and Go Well, which was a study that was conducted in economically deprived areas of Scotland. They used similar questions to that collective efficacy scale, really to measure what social cohesion is. So to give you a sense of what that measurement can look like, some sample questions: to what extent do you feel like you belong to this neighborhood? And measuring agreement with statements like, this is a close-knit neighborhood. So really trying to get a sense of the sense of belonging and the closeness, the social ties within that neighborhood or community. The next domain is social support. And this one is really about the interpersonal relationships and social interactions in one's life. And social support can come from a variety of different people: family, friends, neighborhoods, peers. And it's particularly supportive for physical activity behaviors, especially especially around support for people to be physically active themselves or by having people to be physically active with. There are quite a few tools mentioned in the included papers. And what they really are assessing is if you have people that you feel you can depend on, do you have close personal relationships? Do you have friends and family that can offer verbal support, offer to exercise with you, or do you have tangible support? So, for example, I live in a high-rise apartment building. There's another building on the same property, and we have a Facebook group for the two buildings. And one of the really fascinating things that I just love about living here is that people will often post when they need help. It could be that they're moving a piece of furniture, it could be that they want to borrow something from a neighbor, or it could be that we have many seniors living in the building that aren't able to grocery shop or do their own laundry. And so we can provide assistance to people. We can provide that tangible support because we have that mechanism of the Facebook group. So the next domain is safety. And this might seem like an odd one to be talking about the social environment, but really what we're doing here is trying to describe how your perceived sense of safety impacts the social connections that you have in your neighborhood. So, for example, if you perceive that you live in a high crime neighborhood, you're going to be less likely to go out and talk to your neighbors, to talk to folks when you're out walking on trails or hanging out in a park. In fact, you might not want to hang out in a park if you're living in what you perceive to be a high crime neighborhood. And there are quite a few measurement scales or tools here again around perceived safety. And there was one additional paper that used reported police data in addition to the perceived sense of safety. So the next one is social networks, and here's where we start to get into those intertwined domains. So social support, remember, is when you feel like you have close relationships and people that you can rely on. Social networks are more about casual relationships and interactions with acquaintances and strangers. And you can think about that being on a continuum where the social networks are at one end, which is really about casual and being able to say hi and maybe, have someone to collect your mail when you go on holidays. But the social support is really about, do you need help grocery shopping? Can I call you up if I'm having some kind of emergency? Can I get some kind of tangible support? So they are very related and slightly different, where if I want to expand my social network of casual acquaintances versus actually give and receive support from my close personal relationships. So there are a few different scales or measures in this case that we can use here. So the Go Well survey, and that's the project that I mentioned in Scotland. They had 3 items that measure how many days per week do you speak to neighbors, meet with relatives and friends, or the numbers of days in the past month that participants engaged in 9 different actions with neighbors. So for example, I waved to a neighbor, I spoke to a neighbor. So those are some of the measurement tools, scales rather, that were used in the included papers. Okay, here's another one with the word social in it. Social engagement. So social support is giving and receiving support and attention from your family, friends, and neighbors. Social networks is having that group of people at a more casual level around you. Social engagement is about having the opportunity to participate in community events. They could be social events, cultural, arts and entertainment events, religious activities, or charitable activities. And there were 2 studies here that measured social engagement, and Lee et al. Measured it as regular participation in a number of types of social activities. So religious activities, socialization activities, leisure or charitable activities. And Zhang et al. Actually measured it a little bit differently. In addition to measuring cultural arts and entertainment institutions, Zhang et al. Measured broadband internet access and voting rate, which is a proxy for civic engagement. So a much broader, slightly different measure of social engagement there. The last domain that I'm going to talk about is neighborhood characteristics. And you can think about this as the physical space or the place of the neighborhood. Up until now, we've really been talking about the people. And now we're going to talk about the characteristics of the neighborhood that promote social engagement of some kind. So, for example, are there features of where you live in your community that make it easier for you to connect with people? Are there pathways? Are there walkable streets? Are there parks? Are there third spaces? So, for example, again, in my building, we have an outdoor swimming pool in the summertime, and most of the friends in my building I have met in that swimming pool. That is my third space, the space outside my living space or my workplace where I get to connect and meet with people. So there was one paper that measured neighborhood characteristics, Singh et al., but again in a slightly different way. So Singh used the Canadian Marginalization Index and the Canadian Well-Being Index as proxies for neighborhood characteristics. So they were trying to draw a line between deprivation and well-being to neighborhood characteristics there. Okay, so working in public health, I love a good model or a framework, but there were only two that were identified in this study. The first that I'm going to talk about is a conceptual framework from Kepper et al. And this framework built on an earlier one developed in the 2000s, and they did a scoping review to add on to the framework. And what this framework does is try to connect the dots, or the lines and arrows in this case, between the different factors that influence physical activity and how they connect to one another. And you're going to see some very familiar terms. I just talked about a few of those, and a few of them are slightly different. So we have neighborhood and community characteristics like crime and safety, social cohesion, sense of belonging, and that interacts with social inequalities, which then interacts with social interactions. And not only does that impact physical activity at the individual level, but also at the interpersonal level. So according to this framework, if you were wanting to address the neighborhood social environment to increase physical activity, these are all of the things that you would need to consider, that you would need to build into your initiative in order to increase exercise, play, and active transportation. The second framework I talked about already very briefly, which is the one from the BC CDC, and we're going to paste the link for that in the chat for you. And this conceptual framework depicts 10 features of the social environment. So these are the areas in which we can work if we want to create healthy social environments. So we can work on neighborhood design, we can increase arts and culture opportunities, we can develop the local economy, we can build a sense of civic engagement, we can address housing and food systems. And this particular framework was informed by an environmental scan, Ray literature, published literature reviews, and an advisory committee and focus group and user testing. And one of the things that I really like about this framework is that in subsequent pages in the actual guide, it gives you some very concrete ideas of policies and actions that you can take in each of these 10 features, so that you have a little bit of a starting point. You can get a sense of what are some of the concrete things that you can do to build a healthy social environment. And the ultimate goal for the framework is healthy people living in vibrant communities. And the outcomes are social connection, population health, and community health. Okay, so I've talked an awful lot about the theory. I want to give you a couple of case studies from the literature so that you can get a more concrete sense of what it can look like to develop initiatives that build healthy social environments. And both of these case studies involve walking. Again, quite a lot of research in the physical activity space, particularly around walking. The first one I'm going to mention is Sumner County on the Move. So the included paper in my literature review analyzed the results of a baseline study who enrolled in this walking program, but I wanted to get a sense of what the actual initiative itself looked like. So I looked around and I found the final evaluation report from 2017 by Forthifer et al. And the references are all in the slides, which you will access after the webinar. And so Sumner County on the Move was a community-based program that used strategies for mobilizing, supporting, and reinforcing existing social networks to increase walking in Sumner County in South Carolina. So they did a pretty rigorous communications campaign to self-identify leaders who would then gather a group of folks from their existing social networks to walk. And they didn't necessarily have to walk together as a group. It was encouraged, but scheduling, etc. So the idea was is that the leaders, the self-identified leaders, would provide that support to folks to increase their walking behavior. So the evaluation used a quasi-experimental pre and post test design with 3 time points, and participants reported socio-demographic characteristics, health histories and status. Trained staff measured BMI and blood pressure, and there were self-reported scales as well to measure self-regulation, social support, and physical activity. There was also accelerometers that were used for the 7 days after each test period. And of course, program satisfaction surveys were also done. So the final results was that there were 59 walking groups that were formed, ranging from 2 to 10 members. There were significant increases in goal setting and in social support for physical activity. However, there was no impact in physical activity that was observed. There wasn't social support. People felt more supported, but it didn't necessarily translate into increased walking behavior. The second study is called the Hamilton Active Living Study, or the HAL study, and this is done right down the road from me in Hamilton, Ontario, and it was conducted to learn about people's participation in physical activity and what prevents them. What are the barriers that prevent them from participating in physical activity? And the study was conducted between May and September in 2010, and it adapted a conceptual framework from the physical activity literature to examine how walking as a mode of transport is related to individual, physical, and social environment. So it was really that trifecta that they were looking at. The definition that the study used for social environment was the influence friends and family have on an individual's physical activity. And there were 4 specific components that they were looking at for the social environment: walking companionship, role models, encouragement, and social cohesion. And again, social cohesion is that sense of belonging. There were 30 neighborhoods in Hamilton that were targeted using a stratified random sampling, and measurement was done by phone interview, a 7-day time use diary with GPS tracking, and personal questionnaires. And each of those 4 domains were measured using Likert scale questionnaires. So in terms of results, of all of the aspects of the social environment that this study measured, it was having role models and a sense of neighborhood social cohesion or sense of belonging that increased weekly walking time in Hamilton. So those were the 2 that increased walking time the most: having role models and having that sense of belonging in your community. So I'm going to leave you with a few key messages from all of the talking that I've done and the research that I've done that's all published in the Focus On. And these are some of the things that I'm hoping you will take away from this session. The first is that there is strong evidence that social environments shape health and shape health behaviors. And so this really does provide rationale for being something that we can add in or work to develop in our public health and health promotion interventions. Healthy social environments can be an outcome, so they can be the goal of our program, or they can be the process that we use to achieve the goal. And we can also consider building in features that promote social environments into our existing initiatives. Or we could develop new initiatives that aim to change the social environment. So, for example, when I was talking with my colleague, Natasha Baudouin, who will be doing our February 5th webinar, a couple of the things that she mentioned in the community health center context is a lot of their group programming, so it might be a physical activity program for older adults, also include a social aspect. So there may be a coffee time. And Natasha is also going to be speaking about social prescribing, which is really about a prescription method to get people more involved and engaged, um, more opportunities to participate in activities, and more opportunities to connect with other people. Social environments can be built both at the individual and at the collective level. So, for example, you could be building social environments one-on-one, such as the social prescribing method, or you could be building them collectively within a particular community or within a particular neighborhood. And my big takeaway here is if you are going to be building social environments, either as a goal or as a mechanism in your community initiatives, please define what social environment means in your context, what particular aspect or domain of social environments that you are going to be addressing, and what are the mechanisms and the context of your policy or program. And just as another little example for you, when we do our next webinar next week with Alyssa and Ben and Inga, each of their local work are targeting different domains within that social environment. So you really can look at building social support specifically, developing social cohesion specifically, addressing the social environment through community planning specifically. So I am done talking for a little while, and I would love to hear from you. I'm going to pass this back over to Monica, and we'll see what your questions are.
Thank you so much, Andrea. It's always such a pleasure to hear you present. I love to hear the many examples that you share from your own life, from the literature, which really brings to life some of these concepts that you're sharing. So we'll now, as you've said, move into our Q&A segment to answer some of the questions from our audience here today. And so with that, Andrea, I think you're going to really appreciate the first couple of questions we have here. They are about clarifying what we're talking about, being specific about the language and the concepts that we're speaking to. So the first question here is, when using the term community, is this strictly physical community, or are other kinds of communities such as religious or cultural communities in play?
That's a really great question. And I think the answer is that community can really be self-defined. Or can be defined by the parameters of the initiative that you're designing. So it can be a physical community or a neighborhood. It certainly could be within a cultural community, especially in the United States. A lot of initiatives that are designed to build healthy social environments take place in churches, especially in the South, but not exclusively in the United States. And there certainly are different cultural groups that have a culture in common, or some kind of activity in common that you could define as community. Absolutely.
Great. Okay, and taking that to another level here. So wondering how or if online interactions and networks factor in or contribute to social environments and health.
You know what's so interesting, and it might just be the time parameters that I use for the literature review, because we went back 20 years, so to 2004 when we ran this search. Online really wasn't talked about a lot. There were a few studies that did some virtual counseling or virtual groups or studies that were, for example, to increase walking time, but included some additional phone calls on top of that. I think we would probably have to look in a year or two to see what kind of online supports are coming through. I mean, we know from the gray literature and from what we're hearing, especially during the pandemic, that all that kind of took place, right? But it hasn't come into the literature, at least not in the literature that I saw. But personally, I would include that wherever you are getting your support from is support.
Thanks, Andrea. Okay, we have a couple of questions now that are going into more of the application of these concepts. So, first, this individual is starting to look at social environments in regards to social isolation, social belonging, particularly with older adults. Were there any studies that focus specifically on increasing social belonging within the literature review? They're not sure where to start. So, yeah, any
Yeah,
suggestions
really,
there?
really great question. So I don't think that there was a study that focused exclusively on social belonging or that sense of cohesion, but there were studies that looked at that as well as a number of other things. And I think Oh my goodness, this is such a great question. I think that really getting a solid sense, as I mentioned in my key takeaways, of really trying to define what it is that you mean by social belonging and kind of the parameters, like getting back to that earlier question. Are we talking about a neighborhood space? Are we talking about an online space? Are we talking about a particular group that comes together for programming? I think it'd be really important to define that. And then this is not necessarily a literature response, but if you have this group that you're working with, ask them what it is that they need or want or would respond to. I think would probably be my big piece of advice. And I can certainly dig in, and I'd encourage you to dig into the references in the focus on as well to see what came out in the social belonging literature. I hope that answered
Thanks.
your question.
Thank you, Andrea. So we have a related question, kind of moving along the lifespan. So how to make this practical for vulnerable, hard to reach teenagers, for those who like sports and those
Oof.
who are not in a town who focus on the senior population.
Um, what a great question. And I think to the person who answered this, and actually to all of you, I'd encourage you to come to the January 22nd webinar. Registration is already open for that because we do have Alyssa Bedard from Planet Youth Nipissing, which is a modification or a Canadian adaptation of the Icelandic model, which is really looking at preventing teen substance use. And it does that by addressing the social environment in which these teens live. I can't really give you a particularly concrete answer, but I think that Alyssa will be able to give quite a lot of advice. So I'd recommend coming to that and or looking for information on the Planet Youth model, which is being done across Ontario.
Thanks, Andrea. So our next question is related to the above, but it's a bit more conceptual around implementation. So
Yeah.
as public health, we can be very top down, and they're exploring ways to start more ground up asset based community development. So, any advice coming from the health promotion lens background on that?
Yeah, my first piece of advice would be to really connect in with your community partners and find out who is already doing that work. I've already mentioned community health centers a couple of times, and they tend to do very direct work, and in particular with people who are most impacted by the social determinants of health. And chances are those kinds of groups that you're looking for exist. So it might be a matter of tapping into existing networks and to see what kind of support you can provide or what kind of connections that you can build. You might not need to start very many, but you also might need to. So again, I would really lean on my community partners and to never underestimate the importance of asking people what it is that they need and want. I mentioned this before, but I think sometimes and I'm painting a very broad brush here. I'm not saying that everyone does this, but sometimes it's very easy to rely on the results from our literature review and to develop something in a kind of a theoretical framework and to not spend the time in getting to know that community and what they're going to respond to best. So those would be my two pieces of advice.
Thanks, Andrea. Um, folks are just looking for links to the frameworks again, looking for one specifically, but maybe if we could add both back into the chat pod again, that would be
Yeah.
great.
Yeah, so that
Um,
that particular question was around the BC CDC Healthy Communities Framework. Sorry. Yeah, social environments framework. And even if you just Google that, it will come up.
Perfect. Thank you. Okay, great. So, yeah, another great question here. Have you, or maybe even just within the literature, did anything come up that aligns alongside the Ontario ACES Adverse Childhood Experiences Study Framework?
Yeah, oh my gosh, these are such good questions, Monica.
They
I'm so
are.
glad we have so much time for them. So, there was nothing that came up in the literature specifically, but I wasn't necessarily looking at that sort of early years impact. So a separate literature review might be helpful. Um, I haven't necessarily considered aligning like personally, but I think that even if you just think about it lightly, you can see the connections between social environments and adverse childhood experiences. So I think that would be something really interesting to think about. And if this particular questioner or anyone else is interested in that, please get in touch with me and maybe we can make some linkages and look at it.
Thanks, Andrea. Okay, so I know your case study spoke to physical activity. And this question is asking, are there any specific features of social environments that are most effective at increasing physical activity levels that you saw in the literature?
Yeah, I'm looking down because I'm looking down at my notes, trying to find them. So I think um, so the social support and having role models in particular. So the social support is about having people that can encourage you to be physically active, that you can be physically active with, and that just that whole idea of seeing people be more active helps you to think in your brain, maybe I should be more active too. So the social support and role modeling was really important. But I think that the neighborhood characteristics and perceived safety and the design of the community, which is part of neighborhood characteristics, those are the three that kind of come to the top of my head. But there are, out of the 16 included papers, 7 of them did look at physical activity. So I can go back to those included studies and take another look, or you can just use the references and the focus on to do that too.
Great, thanks, Andrea. So, taking another look at sort of the terms and the theory and the literature,
Yeah.
yeah, in the search, did the term social support? I'm wondering if it's similar to social capital. Did the term social capital come through?
You know what is absolutely wild? It barely did. 2 of
Okay.
the 16 papers mentioned it, right?
Any
And
thoughts
Monica's
on
laughing because
that?
we're both health promoters. Yeah. Yeah, and it's wild because we talk about social capital and health promotion all of the time. So I don't know whether social capital is so specific that it is not seen as social environment. And I'm actually struggling right now to come up with my elevator pitch on social capital, which is really around assets, right? I know that Ben Gallagher from the city of Mississauga is going to be talking about this in our webinar next week. And really interestingly, from an emergency management perspective, is one of the things that they're finding in emergency management is that having that social capital builds resilience for communities so that they can respond to emergencies in a better way. So I think they're all interrelated. I think that social capital is its own thing. And I can go back to the research and find those two papers that mention social capital. But I remember there being two and being astonished that there were only two.
Thanks. Well, we'll stay tuned for next week, and yeah, maybe something to follow up in the discussion there too. Okay, great.
Yeah.
I think now we just have another, just another set of interest in teens, young adults, social belonging and connection, asking specifically about um, if there were any mentions around phone use and social isolation. But I think you had acknowledged that, there is a bit of dearth around sort of that digital social
Yeah.
environment space.
Yeah, the one study that was done with teens that was in the included papers was around sexual behavior, and it found that the social environment was actually a huge predictor of whether or not teens were going to be sexually active. But it was actually a three-paragraph summary, but there's probably more that you can read on that if you think that it would be relevant. And again, this is where maybe it's the fact that we're still just not that far outside of the pandemic and we got delayed in publishing. And I do find that we don't always publish as much as we could in health promotion because sometimes we think that we shouldn't be publishing, that other people should be publishing. Yes, you should be publishing, by the way. But I think that the literature might just be a little bit behind because I didn't see anything around vaping. Now, the other thing just to mention is that I did not include articles that were focused on the school social environment because that context is very, very different from the general community. So I think that maybe a more particularly focused literature review on school environments might get a lot more of this stuff. And if you are interested in looking at that, please get in touch, and we can see if we can put something together for you.
Great. Thank you so much. Okay, now we're following up on the Hamilton study. And from what this individual understood, is that it showed that walking, role modeling, was effective, but walking companionship was not in terms of increasing that walking behavior. So, just wondering if you might have more information about what a walking role model could involve, um, if that included any aspect of companionship or in person connection. Really great question.
That's a really great question. I would have to go back to this study to look at that. The study is in the reference list for the Focus On. And if you want to know if you're unable to find it in the Focus On, just email me and I can dig that up for you. I would have to read the study more closely. I'm sorry about that.
Thanks, Andrea. Okay, great. Now, a little bit more generally, did you read anything about how the design of physical environment can affect the social environment?
Yeah, there was a little bit, and it kind of fell into that neighborhood characteristics domain. And once again, you're going to get tired of me asking you all to attend the webinar next week. But I think this also kind of reinforces I found three really good people for the webinar next week. Inga Rosendahl from Ottawa Public Health is a community planner, and she's co-located within public health in the city of Ottawa. And she is going to be talking specifically around how the physical and built environment can increase and promote social um, social environments. So there were a few things in there. I did mention them very briefly in passing, but they can be things like walkable spaces, street design, and street furniture. If you think about it, if you've got benches, people are going to sit down, and if people are sitting down, they might end up actually talking to one another. So there are
Mhm.
certainly some features that you can take a look at. And if you want to learn more about that, in addition to coming next week, feel free to shoot me an email and I can try to point you in the right direction.
Great. Okay. Um, all right. Now this group is interested in understanding how social environments impact mental health. So, do you recall how mental health outcomes were defined in the literature you reviewed? Another
Again,
excellent question.
Yeah, another excellent question and another shocker, not very much. I mean, there was certainly social isolation was described a lot in the background of the papers as a rationale for looking at social environment, but I don't think that there were any that I can think of that looked at mental health outcomes.
Thanks, Andrea. Okay. Oh, this is a good. Okay, so this is a great question. How would you present this concept to an agency that respects only quantitative research, medical model versus social environmental model?
Oh, I love this question so much. So there is I think there is quantitative research. I mean, the disadvantage here, like I mentioned, is that most of the measures and tools are self-reported. They're Likert scale questions, or not just self-reported, but perceptions, a perceived social support, for example. So I think in folks who get real excited about quantitative research, they might not be as excited about those results. And I have to tell you, and I think most people on this webinar who know me know that I'm not really a quantitative person. I'm a qualitative gal all the way. But in a lot of the papers that I read and that were included in this study, they had quantitative measures, again, using perceived data, but still there were quantitative measures. So I think that the research is showing a strong enough link of the impacts of the social environment on health that it should be enough for folks who get real excited about quantitative. I think part of the rationale that I would use, maybe the socio-environmental model that I showed at the beginning, which is a well-known model. There are variations of it. For example, the Whitehead and Dahlgreen 1991 model. It's the rainbow model. Probably a lot of you have seen that it's the four concentric circles or rainbows with a group of people at the center. There's certainly some models that really can demonstrate the importance of all of those impacts on health beyond the medical model. So maybe those would be helpful. And then another thing, and it really, really depends on the audience that you're talking to, but maybe even some self-reflective questions. How did people feel during COVID when we couldn't leave our houses? How did you feel? I did not feel good myself. And of course, the medical folks were also out there working during COVID and having a really, really, really difficult time. So uh, maybe those strategies will be helpful for you.
Thanks so much, Andrea.
What good questions.
Amazing questions, and I'm very intrigued and curious to attend the follow up sessions because I'm sure it'll be such a rich discussion that follows from those as well. And with that, not seeing any more questions here in our Q&A pod. So before I do wrap it up, Andrea, I just want to leave the floor to you if you have any final messages or that you'd like to leave us with, and from there I can wrap up the session.
Well, I think in addition to coming to our next webinars, which you also mentioned, Monica, um, I think just really be curious about the social environment and what it might mean in the initiatives that you're currently doing, and thinking about ways to weave in social aspects into your current work. And I've mentioned a lot of this already in the course of your questions. Talk to your partners and talk to the people in your communities that you are going to be working with and for, and see what it is that is going to support their social environments best.
Thanks so much. So, as we wrap up today, thanks again, Andrea. And of course, a special thank you to everyone who joined us today. A reminder to everyone to save the date. That topic, the Ontario Public Health Convention, is going to be held on March 26th and April 2nd of this year. So you can check out www.tophc.ca for details. Lastly, you'll receive a brief anonymous survey for today's session. So please take a moment to complete it. Your feedback is really important and helps us improve our programming. And with that, thank you all so much and wishing you a wonderful day and a week ahead.
Thank you, everyone.